Texas abortion laws are straining the women's healthcare workforce and depleting the number of doctors entering and staying in the state. That's according to a new study. Manat Health found more than 70% of practicing obstetrician gynecologists in Texas feel the near total ban on abortion is prohibiting them from practicing medicine according to best practices.
That study also showed 21% of OBGYNs have considered leaving the state, and recruiting new talent to take their place is also proving difficult, with residency applications for this field of medicine going down. On our website right now, you can dig into this study and hear directly from several practicing doctors and medical students about how this is impacting the workforce.
Now, patients are also being impacted as well for these reasons and others. Recently, another study found a portion of patients across the country are having trouble getting an appointment with their OBGYN. Some are seeing long wait times to get one of those appointments. Others have even had those appointments canceled by their practitioner. But here's what some patients may not know. Their primary care doctor is able to step in and help and often provide some gynecologic services and care for them. So joining us today is Dr. Meghan Williams. She is an internal medicine physician with Harbor Health. Thanks so much for being here.
Thank you for having me. I'm so happy to be here.
So let's start with that. What are some services that patients may not even know they can ask you for?
I regularly have people tell me they're surprised that we can do something as simple as a pelvic exam or a pap smear, but even talking about hormones, menopause, PCOS, primary care is really pretty full spectrum, and that should and usually does include like a lot of those gynecological things that sometimes people feel like they can only get from their gynecologist.
A pretty wide umbrella of kind of care that you can provide. So what are you hearing from patients as they're coming into your clinics? Are you seeing more people come in asking for this type of care?
Yeah, I don't know that I would say they're asking for it. I think what I'm hearing is an expression of distress because they don't know where they can find it. And then a sense of surprise and relief to find out that they can actually get it from me and from other colleagues that I have at Harbor too.
Are you hearing from your patients, maybe the reason they're not able to get those appointments, or are they just generally confused about the difficulty?
I think both. I do feel like that workforce shortage that the study hinted at, or not hinted at, just explained, but we've been seeing that, I think, on the ground for the last several years, and people saying they just can't get in to see their gynecologist. Maybe they want an intrauterine device placed or removed, but they're waiting 6 to 8 months for that.
Wow.
And are these services that most doctors are trained for and ready to provide?
I think it really depends on the person. I wouldn't say that all primary care providers are going to be able to place an intrauterine device, but it really just varies on the practice and the person. But there's definitely a growing trend towards realizing that this is part of our scope of practice and we need to do better in training our workforce so that when they enter into the profession, they're ready to provide those services.
It's our understanding that's something you're doing at Harbor Health, but also you're an associate professor at Dell Medical School. So talk about what that training looks like for really the future of the workforce.
I think it's an exciting time to be in primary care and academic medicine because we are just learning that it's so important to make sure that we're thinking about that full spectrum comprehensive care to provide patients. So making sure that includes sexual health, reproductive health, and training residents to do things like placing intrauterine devices or Nexplanon or all those things that are part of their scope of practice.
Dr. Williams, we could probably keep you here much longer, but thank you so much. This is such interesting advice for patients who are probably looking at those online portals and going, gosh, I'm not sure where to turn. So Dr. Williams, we would love to catch up with you in the future, and thank you so much for all the helpful context here.
Yeah, thank you so much.
We'll be back after the break.